How does the disease affect patients and their families?
Well, by far the biggest symptom that affects patients and their families is the itching. And the itching, or the medical term is pruritus, really is all encompassing for these children. Specifically, it alters their ability to sleep through the night because they're itching in the middle of the night. And that not only affects them and their sleep patterns, but also the following day. They're more moody and irritable because they haven't slept well. They have difficulty learning because of chronic sleep deprivation. In addition, the parents, as you can imagine, also aren't sleeping well if their child is having difficulties with the itching at night and not sleeping. The itching impacts every aspect of daily living. Another example is it's difficult for them to sit and enjoy a family meal because they're always fighting the sensation of itching while they're trying to have a conversation and eat a meal with the family. It affects their socialization with others for the similar reasons. So by far, itching has the biggest impact on the quality of life for these patients. The second symptom that affects the patients more specifically is the difficulties with growth because of the disease pathophysiology, where you're not breaking down and metabolizing fats properly, based on the problems with fat malabsorption in the intestines. It's difficult for these children to gain weight and grow in height appropriately. So I think that, in addition to the malabsorption of fat soluble vitamin deficiencies, are another major impact that the children have to deal with based on this disease. And then finally, there's the chronic stress of living with a chronic disease, and specifically with PFIC, not knowing when is it going to take a turn for the worse, how quickly will it progress, when and if I will need, the patient will need a transplant. All those questions are in the back of the patient's mind and the families. And I think that creates this chronic underlying stress related to the disease.
What does disease progression usually look like for these children?
The disease progression can be very variable. For example, you may have a child who presents early in infancy with severe manifestations of the disease that then leads to cirrhosis and the need for liver transplant in the first year or two of life. Some patients, however, the itching may be prominent in the early years of life, but then over time, the severity of that itching diminishes. And whether it's a true decrease in the sensation of itching, or does the older child learn how to deal with that sensation of itching and actually control their response to it and make themselves itch less so that they don't scar. So in some kids, that progression of the itching can stabilize or diminish over time. But the vast majority of children, the disease will slowly progress, and in some subset, it's more rapid, so that the majority will one day need a liver transplant.
How is it possible that some patients aren't diagnosed until adolescence?
The reason that some children might not be diagnosed until adolescence is at least twofold. One, they've been misdiagnosed their whole childhood. For example, we've met children that were told they had severe forms of eczema, an allergic skin condition, when the whole time they actually had PFIC. Or it is also possible that they have a more mild form of the disease. And what I mean by that is the penetrance of disease can vary significantly between individuals. So if, and this may be related to the actual genetic mutation that the patient has. So some genetic mutations within the PFIC families may be associated with a less severe form of the disease, and therefore they really didn't show the complete progression of the liver injury until later in childhood.